Hello everyone, I'm Dr. Mustafa. I'm an oncology resident and this is my channel Red Scrubs. Imagine a simple blood test or a scan that within few days would give you a certain results about whether you have cancer or no, even way before that any symptoms would appear. It's the holy grail of oncology, isn't it? Well, of course it is. Also, it would give us advantage about detecting cancer on early stages, which would give us another advantage of defeating it. So why it's important to detect cancer on early stages? Well, in order to understand that, let's take a look at the cancer on its early stages. So, in its early days, the cancer is a small, teeny tiny cells that are located in a specific place, and they are usually surrounded with a capsule. So the cancer is not big enough to make any dysfunction of the organ that's located in, and also they are not advanced enough to make any metastasis to the surrounding organs. So a cancer on early stages is like a small fire that you can take absolute control on it before it gets bigger, and then it would go out of control. On early stages of cancer, surgery is curative because the surgeon would be able to remove the entire tumor, which is a small one in this case, in one piece with a small margin, and also effectively completely removing the disease from the body. Second good thing we get from detecting cancer at early stages is going to be less aggressive treatment. So as we said in the first point, treatments could be only surgical. So we remove the tumor and that's it, fine. So we won't need for aggressive systemic treatments such as long sessions of chemotherapy. But it could be only short chemotherapy sessions, I mean periods, or would be only localized small dose of radiotherapy. Also, some other options would be available, such as photodynamic therapy, or in some cases, only radiotherapy would be available, such as prostate cancer. Speaking about prostate cancer is a good example because usually the tumor at early stages is surrounded by a capsule in a small specific place, and it would be vivid. So a radiotherapy would be a perfect choice for that. And also prostate cancer cells are highly sensitive to radiation. One more great advantage that we would get from detecting cancer on early stage is higher survival rate. So 99% of the patients that been detected on early stage and got treated would live for 5 years or more, comparing to those who their cancer got detected on late stages, third or fourth stage. And in those stages, probably the cancer would metastase on lymph nodes or on the surrounding organs. So if catching and detecting cancer on early staging is amazing, powerful, and great, so why it's difficult to catch it? Well, because cancer on early stages is a master of stealth. It usually hides, shows no symptoms at all. The patient would not feel anything. And also, it's very tiny and small, so during physical examination, won't be detected at all. And also, it won't cause any hormonal changes in the body. Also, won't cause any changes on blood tests, biochemical tests, and so on. So, there is no way basically to find it. Also, due to its small size, it will not yet make any pressure on the organ that it's located in. So it won't give any feel or any feeling of pain or dysfunction of the organ. So what tools do we have to detect this invader? Well, we have the following tools. One of the most important methods, and the first one we have, is imaging. Mammographs for breast cancer, especially for ladies who are over 40 years old, or for those who have a family history of having breast cancer. Colonoscopy also, or a small dose of CT scan for individuals with higher risk of lung cancer due to their family history. Physical exams could come handy for checking for any abnormalities, but usually it's not that useful, because on early stages, as I said, the cancer is very small and it's very difficult to detect it in physical exam. Except for imaging, we have the biopsy or tissue biopsy. But in this case, when we already get to the place where we need to take biopsy, it means that there are significant changes occurred already in the patient. So in this stage, the patient would probably experience pain or changes that happen in his body. So we need to know where to look first and then to take biopsy from, for example, from stomach. If the patient would have a trouble or problem in his stomach, then we know that we need to look at the stomach, and if we see any changes in the tissue of the stomach, then we will take the biopsy. And biopsy, by the way, is considered the gold standard of detecting cancer, because the biopsy, or the small part of the tissue that we would take, it must be sent to the lab to check whether this cell is benign or cancer cell. So since we have those different tools of early detecting cancer, or even detecting cancer on late stages, such as biopsy, what about the blood sample that I've mentioned earlier in this video? Is it real that this is the magical tool that we've been waiting for a long time? So can we actually take a small portion of blood and we can know whether the patient has cancer or no? Well, this would lead us directly to the tumor markers. What are they? What's the use of them? Are they accurate or no? Are they useful actually to detect cancer on early stages? Well, let's find out. Let's start with basic things. So, oncomarkers or tumor markers are substances that been released either by the cancer cells themselves or by normal cells in the body, but in response to the presence of cancer cells. Those oncomarkers or tumor markers are usually found in the blood. So how it works, the mechanism of it is a cancer cell, due to its mutation, would produce a high amount of a specific protein that the normal cell of the body would produce, but in a very small amount, unlike the cancer cell. So, for example, speaking about the prostate cancer, usually the prostate produce a specific agent that called PSA, which liquefy the semen. But due to the distribution of the prostate by the cancer, this factor would leak into the bloodstream, which would make it vivid in the test that we would make. So as the tumor grows, or continue growing because it grows infinitely and non-stop, some of the cells would die and break to parts. And those parts can be detected as markers or as tumor markers, also due to the immune response of the body that would start breaking those cells or those cancer cells that might be detected by the immune system in the body. Actually, most of the cases it's not being detected, but in some cases, yeah. Also, breaking down those cells would produce those markers that can be misleading. The idea is simple. The more cancer cells there are, the more of these markers would be detected, and higher level we can see in the patient's blood. Also, usually we hear about specific types of tumor markers for a specific type of a cancer. For example, PSA for prostate cancer, CA125 for ovarian cancer, CEA for colorectal cancer, and AFP for liver cancer. So here we will come to the core of this topic. So as we said, when the cancer is big, the higher level of the tumor markers would be found in the blood. So we can use this method to early detect cancer, yeah? Because if we have high level of tumor markers in the blood, this would mean the cancer is big and it exists, yeah? Well, logically, yes, but the truth is a little bit far away from this because it's more complicated than it appears. Well, as a matter of fact, it's not really useful method for early detecting a cancer. And there are three main reasons why it's not really effective. The first problem here we have is problem of specificity, because the tumor markers are not cancer specific. So we call them tumor associated, not tumor specific. So they can be also released not only in cancer cells existence, but also if there is a benign tumor. For example, PSA is supposed to be the marker of the prostate cancer, yeah? Well, actually no, because it also gets high when a simple prostate happens, or even if there is benign tumor in prostate. So it could be misleading. Also, CA125 can be detected in endometriosis and even in pregnancy sometimes. So in this case also, it's not only cancer. The second problem we have is the problem of sensitivity. So as we said, the bigger tumor it is, the higher level of tumor markers would be shown in the blood. Yeah? Well, yes, but this is actually a problem, not an advantage, because on early stage, the cancer is in the size of a pea, so it's very small, and therefore it will not give us a high rate of the tumor marker. And therefore, if we would provide this test on an early stage of cancer, it would give us false negative. It would give us less level of the marker that we would need to say that this or that patient have a cancer. So we will get a negative result, but matter of fact, there is actually a cancer in the body, but it's very small to be detected using this method. So in order to reach the needed level of the tumor marker to tell us that there is a cancer, there would be a bigger problem, because in this level, the cancer is much bigger than early stage. It's already end of the second stage, beginning of the third stage, or even maybe the fourth. And here we would lose the window or the chance to detect the early stage of the cancer. So still useless. So if not for early detection, then what's the use of them? If they are failing their job of detecting cancer on early stages and they cannot tell us whether there is cancer or no until it's too late, then why it's still used pretty much in every clinic? Well, because their true value is not lied in finding the cancer on early stage, but it's more of a screening method or controlling the treatment process, or also the recurrency of the tumor after the treatment. Another useful thing that we can get from the tumor markers is to help us in diagnosis and staging. So if a doctor saw a mass in the liver, for example, in a CT, then he would go to the oncomarker test and check for it. If it was high, then it would say that there is a cancer actually in that mass. And also, speaking about staging, CT scan, yes, can show us the mass, the location of the mass. But if the tumor marker was very high, then it would give a hint to the doctor that the stage could not be as low as he thought in accordance with the CT. Therefore, he would get the patient to do more tests to get more accurate information to put the right stage. Determining prognosis is another useful thing that we can get from the markers. For example, in testicle cancer, if the marker of it is very high, then it would tell us that this type of cancer is aggressive. So we need to be careful about that, about the method of the treatment, chemotherapy, radiotherapy, and so on. And also after the patient got treated. So there is a good chance of the cancer coming back. And speaking about chemotherapy, the tumor markers are significantly relevant here because they can show us the way how the treatment is going on. So if we have given the first session of the chemotherapy, after that we can actually order an oncomarker test for the patient, and if we saw regression or a low level of this marker in the patient, this would give us a hint that the treatment is correctly chosen and it's working just fine. But if after the first or the second session the marker was high in the blood, then it would tell us that we need to reconsider the treatment plan. We need to change the medication that we're using, and therefore no need to wait more. So once we know that with this certain type of chemotherapy the oncomarker is high, then here we need to stop and change the plan of treatment. Otherwise it would be dangerous for the life of the patient. And also surveillance of recurrence. So after the treatment plan is over for the patient can come to see the doctor every couple of months, for example, and to check for the recurrence of the cancer, whether it's there or it's not. And in this case, we would also use the tumor markers, because after treatment, if there are no oncomarkers in the blood stream, then the patient is pretty much fine. And if we got a positive result, then we need to look again for a tumor. So eventually the oncomarkers is not the best thing to use if we want to detect the cancer on early stage. It can be helpful, as we saw, to make sure that there is actually a cancer after CT scan imaging or after we see a mass in an organ. And also it's useful to see or to give us a hint about the stage of the cancer, but definitely not a method of early detecting cancer. For early detecting cancer, there's another method that's called liquid biopsy, and we can speak about this in another time. So if it's interesting, let me know down below in the comments. And before you leave, hit the like button, share, and subscribe the channel if you're not subscribed yet. See you later.